A patient once told me they followed every medical instruction before surgery, fasting, meds, checklists, but they forgot one thing: arranging support at home. That oversight turned an easy recovery into a week of stress, missed meds, and pain. This happens all the time, and it's completely avoidable. Let's break down the 3 things that would have prevented it: emotional steadiness, practical planning, and one vital phone call most people neglect. People often believe that the success of a surgery rests on the hands of the surgeon, but a large part of that success begins long before the first incision. Hospitals routinely see patients who are medically ready but logistically unprepared. They might have fasted, followed every instruction, and arrived on time, yet one simple gap, like not arranging transportation or home help, can unravel the recovery process. Logistical readiness is the invisible half of surgery prep, and most people don't realize how much it matters until something goes wrong. A smooth procedure on the operating table means very little if you leave the hospital without the right support waiting at home. The Washington University surgery team is clear that after anesthesia, you are not able to drive yourself home. It's not just a suggestion, it's a strict medical rule for your safety. The same applies if you're taking prescription pain medicine. Even mild sedation can impair reaction time and focus, making driving or navigating home alone dangerous. Yet, every week, patients arrive expecting to drive themselves or take a taxi, unaware that hospitals will not release them without a responsible adult present. Take the story of Ellen, a patient in her 50s who had a routine outpatient knee procedure. The surgery went flawlessly, but when she woke up, her friend had an unexpected work emergency and couldn't pick her up. The hospital couldn't legally release Ellen to drive or leave alone. Her discharge was delayed 6 hours. By the time she arrived home, the pharmacy had closed, and she couldn't fill her prescribed pain relief. What should have been a calm recovery turned into a restless night of pain and anxiety, all from a missed ride. Experts from the University of Maryland Medical Center and Mayo Clinic Health System emphasize that surgical readiness includes arranging transportation, securing a helper, and ensuring prescriptions are filled beforehand. These steps are not optional. They form the groundwork for safe healing and prevent unnecessary readmissions. Research shows that patients who plan these details experience lower stress levels and report fewer complications. It's simple, but powerful. Less uncertainty equals less strain on the body during recovery. Anesthesia can leave lingering effects for hours after surgery. Memory lapses, delayed reflexes, and poor coordination make it unsafe to be alone. Even simple tasks, like climbing stairs or preparing food, become risks if you lose balance or experience dizziness. Support from a friend or family member provides not just physical help, but peace of mind. Hospitals see fewer unplanned readmissions among patients who have structured home support because these small details prevent minor issues from turning into emergencies. So, the first truth most surgeons assume you already know is that recovery doesn't start in the hospital. It starts with safe, planned transportation and trusted support. When that foundation is solid, everything else runs smoother. But even when the logistics are perfect, surgery success can still fall apart if your mind is tense and anxious the night before. Even when you've planned every detail, the ride, the meals, the medication, your recovery can still stall if your mind is tense. Anxiety before surgery is more than nervousness. It triggers a chain reaction inside the body that can slow healing and increase pain afterward. Hospitals see this happen often. Patients arrive with stable vital signs but elevated stress hormones, and that alone can make anesthesia more complicated and recovery more uncomfortable. When your body senses fear, it reacts as though danger is near. Blood pressure rises, breathing changes, and your immune system diverts energy away from repairing tissue. The night before surgery is when it usually shows up. Take someone like Mark, who's scheduled for a routine hernia repair. He lies awake until 3 a.m., heart pounding, replaying every what-if thought in his head. He feels drained the next morning and struggles through check-in. His body is on high alert, which affects how anesthesia works and how he feels when waking up. He ends up staying longer than expected, while nurses monitor his blood pressure. The operation itself was fine, but exhaustion and tension turned an ordinary day into a longer, harder recovery. That level of stress is common, but it's also preventable. Health systems recommend preparing the mind the same way you prepare the body. Simple steps like mindful breathing, short reflections of gratitude, or quiet time before bed lower the stress response. A gratitude journal can also help by shifting focus from fear toward positive outcomes. These methods don't require special equipment or long sessions, just consistency. When practiced regularly in the days leading up to surgery, they can calm the nervous system, slow the heart rate, and improve oxygen levels during anesthesia. Studies tracking surgical patients show that mindfulness practice often results in faster recovery and less reported pain. Participants who used breathing or journaling techniques before surgery had lower stress hormone levels and required fewer pain medications afterward. Programs like the Surgical Prehabilitation and Readiness Initiative at Washington University include mindfulness training along with nutrition and exercise support, acknowledging that mental calmness directly affects physical outcomes. This isn't mind over matter, it's mind working with matter. By stabilizing stress hormones and improving circulation, emotional readiness creates an internal environment where healing can happen more efficiently. Still, hospitals tend to mention these mental tools only briefly in their pre-op instructions. You might see a line about reducing stress or remaining calm, but little guidance on how to do it effectively. Patients are left to interpret what that actually means when they're already anxious and short on time. That gap between advice and application can leave even well-prepared people struggling to manage fear on their own. The second truth becomes clear here. Your emotional stability is just as vital as sterile instruments in the operating room. But even the calmest patient can face one last obstacle, and it often starts with a call that never gets made. Many patients arrive prepared, calm, and confident, only to hear that their surgery can't proceed once they check in. It's not because of a scheduling mix-up or a paperwork issue. It's because of something small they never mentioned: a mild cough, a rash near the incision site, or a fever the night before. That one detail can cancel months of planning in seconds. The truth is that hospitals must postpone procedures when there's even a small sign of illness. It protects you, not the schedule. Yet this rule often catches people off guard because no one expects a simple cold to threaten a surgical plan. The rule centers on communication. Surgeons count on patients to report any new or lingering symptoms before arriving. A cold, sinus infection, or stomach virus might seem harmless, but anesthesia changes how the body responds to infection. Something manageable at home can become dangerous on the operating table. Fever, wheezing, or shortness of breath increase anesthesia risks and strain the heart and lungs. Even an infected patch of skin near the surgical site can introduce bacteria into the wound and lead to major complications afterward. These conditions often appear minor but can quietly multiply the danger of undergoing surgery. Hospitals that practice strict safety protocols require early communication because it's easier to adjust plans than to manage complications later. If you've had a cold or sinus infection within 2 weeks, pneumonia or bronchitis within a month, or a stomach virus recently, it's often safest to reschedule. The same goes if you've experienced chest pain stronger than usual, uncontrolled diabetes, or an asthma flare-up. These aren't minor inconveniences. They affect how your body handles medication and recovery. By calling your surgeon's office as soon as you feel unwell, doctors can evaluate your situation and make a clear decision without last-minute confusion or wasted operating time. Many outpatient centers even provide direct phone lines for this reason. Patients with procedures at the ambulatory surgical care unit are instructed to call the nurse in charge immediately if they're sick or if their surgery must be canceled. That single call allows the team to review your symptoms, decide whether it's safe to proceed, and prevent you from showing up only to be turned away. It also helps the hospital use its time and resources efficiently while protecting your safety. One common scenario involves a patient who hides a mild throat irritation out of fear that surgery might be delayed. When the anesthesia team detects the cough or fever during the pre-op check, they must halt the process. Everyone loses valuable time and the patient faces unnecessary stress. If that person had called a day earlier, the operation could have been safely moved without the chaos. Information is what keeps surgery safe. When in doubt, pick up the phone. That one call shields you from infection risk, avoids cancellation, and protects the entire surgical plan. Knowledge, mental readiness, and honest communication are what truly determine how smoothly your recovery begins. Surgery success starts long before the operating room. It begins with your planning, mindset, and honesty. Hospitals encourage every patient to create a simple checklist and talk openly with their care team. That conversation builds confidence and prevents last-minute problems. Before your procedure, arrange a reliable ride and help at home. Manage your stress with calm routines and report any illness immediately. These steps work together to keep your recovery smooth and safe. Most people think skillful surgeons guarantee perfect outcomes, but now you know the real secret. What you do at home determines how well you heal afterward.